Hi, I'm Laura Padilla, and I am a medical physicist at the University of California, San Diego. I am going to take the next 4 minutes to tell you about a Health Disparities curriculum for medical physics trainees that Dina Garcia and I created. The COVID-19 pandemic put the spotlight on the long-standing and pervasive health disparities that exist in the U.S. They are driven by underlying structural inequities rooted in racism and intersecting systems of power. Improvement of these issues is complex, but having a team of informed individuals can help spark change. This is why healthcare professionals must have at least basic knowledge of health disparities concepts so that they can identify them, understand their personal role in either perpetuating or lessening them, and help find ways to resolve them so that they can improve the care of all patients. As medical physicists become a more front-facing member of the healthcare team, it is important that our trainees get exposed to these topics. To address this current gap, we designed an introductory health disparities curriculum for medical physics graduate students and residents. Our curriculum has the following learning objectives. Explain how structural and institutional racism and the social determinants of equity contribute to disparities in cancer and access to treatment. Examine mistrust, bias, and stereotyping using radiation oncology as an example. Identify your role in adopting or developing strategies to address disparities in patient care within your department. And lastly, identify how your knowledge of disparities in cancer and social determinants of equity can help better design public outreach initiatives to combat misinformation about radiation. The course was voluntary and it consisted of 4 weekly 1.5-hour synchronous online sessions done on Zoom. Sessions were developed based on transformative learning theory, and they involved didactic lectures, case studies, large and small group discussions, and reflection exercises. Session topics included structural racism, social determinants of equity, patient mistrust, implicit bias, public outreach, and critical reflection. For each session, participants were asked to fill out pre- and post surveys to evaluate the curriculum's impact. Due to the relevance and timeliness of the topic, trainees were encouraged to attend any part of the course, as we decided it was more important for them to get exposure to health disparities training at any level, rather than for us to prioritize having complete sets of data to analyze the impact of the curriculum. We had 15 trainees that attended at least part of the course, with 8 to 11 trainees in each session. Most participants reported feeling more competent in explaining the relevance of health disparities in medical physics, addressing mistrust, bias, and stereotyping during patient-provider encounters, engaging in critical reflection, and designing public engagement strategies to reduce health disparities. Overall, participants reported being likely or very likely to explore issues related to health disparities in their field. They would all recommend this course to their colleagues, and they all reported being satisfied with the topics, atmosphere to discuss sensitive issues, the virtual format, activities conducted, and the facilitators. The results of this pilot showed the feasibility of successfully implementing a health disparities curriculum for medical physics trainees. Future works include expanding the implementation of this curriculum to other programs so we can broaden its reach and better evaluate its impact. We would also like to create a version of it that's geared towards radiation oncology medical residents. So if you would like to collaborate with us, please don't hesitate to reach out. We'd be happy to answer any questions that you may have as well. Thank you so much for listening to our talk, and we look forward to hearing from you.